Okay, one more time here. Perfect. Okay, so again, we're gonna let that dry 30 to 45 seconds. And the same thing as before, we're gonna pop this off, make sure our hub is a little bit loose there. You doing okay there, Bob?
Doing great.
Perfect.
Thanks for checking in with me.
You're very welcome. All right, so again, we're gonna go ahead and pull this taut. I'm gonna go in a 30 to 45 degree angle. Got that in there. We see the flash back. So now we're gonna go ahead and advance that. Perfect, and pull out that needle. Perfect. Okay, so we're gonna go ahead and dispose of that in the sharps. Wonderful. I'm gonna go ahead and I've already held pressure above where the catheter tip is so that we don't get any blood come back because it gets very messy. I'm gonna go ahead and check there again. Perfect. That is ready. We're gonna go ahead. I wanna take that out. I thought it was gonna pop off and it didn't. All right, so here we go. Make sure that's nice and stabilized. Okay, Bob, so what's gonna happen now is we're gonna go ahead and administer some saline, okay? It's gonna be a flush, okay? So the first thing we're gonna do is pull back, make sure we have flash there, which we do. Okay, so I'm gonna go ahead and release that tourniquet. All right, so Bob, let me know if you feel any kind of hot, flash, anything like that uncomfortable, okay?
Okay.
So we're gonna go ahead and administer the 5 mils fairly slowly. Still doing good, Bob?
Doing good. Kind of tastes metallic-y in my mouth.
Yeah, that's gonna happen. I should have warned you about that right off the bat.
Oh, that's okay. That's okay.
All right. So we're making sure that's nice and stabilized. All right, so we have the 5 mils in there. You still doing okay, Bob?
Doing great. Doing great.
Okay. So again, I'm gonna stabilize that, take that off of there. All right. Okay, so the next thing I'm gonna do is I'm gonna take my piece of tape and I'm gonna do a little chevron here. You okay, Bob?
Doing great. Doing great.
Okay. Hold steady for me. Okay, we're gonna go ahead and put a piece of gauze underneath of this just to kind of hold it, and then I'm gonna grab an alcohol swab and we'll clean you up.
Thanks. Appreciate that, Ashley.
All right, Bob, in to out. I don't think we have any other blood anywhere else. We look good.
Did really good. Really good.
Awesome. Okay, so we're just gonna go ahead and tape this site down one more time here. Make sure that we got you all nice and secure. Perfect there. And then we're gonna go ahead and take our Tegaderm here that we've already pre-labeled. Oh, crap. Okay, so we ruined that one, Bob.
Oh, that's
I'm
okay.
sorry.
We'll get another
one.
one.
Are you okay to hold there just a minute?
Oh, I'm doing great. I'm doing great.
Perfect.
My bed's down, so you can step out if you have to.
Well, I'm not going to step out, Bob. I brought a second one with me.
You're so prepared.
Okay, so as long as you're still doing okay there.
Doing great. Doing great.
I'm going to re-put the date on that we're starting this. Start time, my initials. The arm that we left, the 20 gauge needle. Perfect. All right, Bob, here we go. We're gonna go ahead and go right over that site, not over the hub. Okay. All right. You still doing okay?
Doing great. Doing great.
All right, so I'm continuing to monitor. I'm gonna put one more stick over here. It seems like this is not holding down just enough there. I'm gonna go ahead and continue to monitor the site, make sure we don't have any redness, flushing, anything like that. We don't want that. Want Bob to stay nice and clean. Okay, so once this is all hooked up, just gonna make sure Bob's kind of comfortable. I'm gonna go ahead and then get my tubing ready. You still doing okay, Bob?
Doing great.
All right.
Is this the stuff they're gonna be putting into me now?
This is the stuff. This is that saline. It's gonna help get you hydrated.
Okay.
All right. So I'm just gonna make sure, check the line that we don't have any bubbles here, Bob.
Why don't we want any bubbles?
Because you don't want any bubbles in that IV because it can do stuff to that vein.
Oh, I suppose you want
Damage
blood in there
that
and
vein.
not air.
You do.
Yeah, that makes sense.
We don't want any of that. Okay. So now that we have that checked, I'm gonna go ahead. Hold that. Perfect. So again, we've maintained sterility because this is there. That cap is still on. We are going to re-cleanse this port here, Bob, one more time. Make sure that that's nice and clean.
Sounds good. Sounds good.
Okay. All right. So we're going to go ahead and remove this glue and we'll hook you right up here. And I'm just holding this hub right here in place so that just, from the turning here, we don't have any whoopsies.
Good stuff. Good stuff.
All right. Make sure that's nice and secure. Okay, so the next thing we're going to do is we're going to, again, continue to monitor Bob, and we are going to set up our drip rate. We want it to be at 21 drops a minute, so we're going to go ahead and set that up now. Are you still doing okay, Bob?
Doing great. Doing great.
Alright, so we are there. 21 drops per 1 minute. Wonderful. Okay, Bob, are you doing okay?
Doing great. Doing great.
Okay, so the next thing I'm going to do, Bob, now that we have that set, is I'm going to tape up this so that when you're laying there and stuff, you're not going to pull on this and then rip that IV out.
Oh, thanks. I really appreciate that. Really
You
appreciate it.
bet. Okay. So I'm going to go ahead and do one. I don't want to get it in the way of this, so I'm going to go ahead and do one right at this side. Do one right here, actually, on Bob's wrist here. This lovely thing. Take this first one right here. And I'm going to go ahead and do one right up here. Above that. Something is funky. Okay. And then it's going to go up Bob's arm, so I can go ahead and do one more if we needed to. Bob's fairly good. I mean, we'll put one right here. Then that way it kind of has a secondary stabilization. Are you doing okay, Bob?
Yeah, I like
Okay.
that you taped that. I mean, I don't expect to go on any runs, but I might roll around a little.
Yeah, it just kind of helps secure it so you have a little bit of safety there. Okay, so now that we have Bob set up, Bob, we're going to go ahead and continue to monitor you for any inflammation, any redness, any irritation around this injection site that we just did. Is there anything you have any questions about?
Yeah, what should I look for? Should I look for anything weird?
Any redness, any irritation, if it's painful, all that kind of stuff you need to tell me so that we can figure out what's going on, and we might even have to remove it from this side and try it on the other arm.
All right, I'll ring that their call light if I see anything funny.
Perfect. That's exactly what we want you to do. Okay, Bob, so what I'm going to do is I'm just going to go ahead and clean up my area. I'm going to continue to monitor you for a little bit just to make sure that when we started this, it doesn't have any issues, okay?
Okay, sounds
Give you
great.
a little time. I'm going to lower your bed back down to the lowest position. I'm going to keep those side rails up just for your safety.
Oh, thanks.
Yep, you bet. I'm going to give you your call light, and you remember how to work that, right?
push the red button with the cross on it and you come running.
Yep, I do. Okay, do you have any other questions for me?
I don't think so. I'll just get back to watching TV.
All right, perfect. I'm going to go ahead and clean everything up, wash my hands, and then I'm going to document that we started the IV infusion in the left arm with a 20 gauge needle for Bob Johnson. The time that we started the infusion, 1300, that it's 125 mils per hour, per hour, at 21 drops per minute. I'm going to document Bob's reaction to the procedure. I am going to document because we had a faulty needle the first time. I'm going to document that and state that we had to, get the correct one.